Hi, today in Psychiatry in 5 minutes, we're going to cover nicotine use disorder or how to stop smoking or how to assist patients in stopping smoking. The first thing is that nicotine is the most dangerous drug of all we have. That is, nicotine or tobacco kills more people than any other substance. And of course, those deaths are typically from heart disease or pulmonary disease. So it is important to try to get the patient to stop. Know that it will take many people, many quit attempts to stop. But here are some tips. First of all, set a quit date. The date should be about 2 weeks from now. They should be able to plan when they're going to quit so they can get ready for it. Remember that planned events in life you usually do better than impulsive acts in life, and that's a general truism for everything in life, but it's also true for treating people for nicotine withdrawal. Know that nicotine withdrawal can be quite difficult, and people who were addicted to other substances say that stopping smoking may be harder than stopping other substances they have been addicted to. Set a quit date 2 weeks from now. Second, use medication to help. What medications are available? Generally, we have 3. Nicotine replacement. Patches are generally easier to use. And depending on the amount somebody is smoking, you use either 21 milligram or 14 milligram patch to begin. Know that you will decrease it to the next level down in 2 weeks. If somebody's having a lot of problems, with withdrawal symptoms, it certainly is fine to continue it longer than that. It's not a race. As long as you get there, as long as they're making progress, you take that progress and go from there. Know also that nicotine's available in gum. It can be problematic for people to use. You have to chew it, park it in your cheek. Chew it, park it in your cheek. And that can make it difficult. Lozenges are sometimes popular because instead of going for a cigarette, sometimes people pop a lozenge in their mouth, and that can be helpful for some folks. So nicotine is the first bet. Second thing to use is bupropion, and bupropion can be helpful in nicotine withdrawal, whether somebody has a depression disorder or not. And that works about the same whether they have a depression disorder or not. So bupropion is helpful. Again, begin the pill knowing that it's going to take 2 weeks to get up the pill to a reasonable level in your body. Generally, people aim for at least 300 milligrams a day. Third thing to use is varenicline or Chantix. Again, you start at low dose and gradually build up. Chantix or varenicline works better than the other two, but unfortunately it's more expensive. And so managed care companies will very often want you to make sure somebody has failed trials of nicotine replacement and bupropion before they'll pay for Chantix. Chantix can be associated with suicidal ideation. It's quite uncommon, but it's important to ask people about suicidal ideation and gauge how suicidal they are. If somebody is depressed, it doesn't rule out the use of Chantix. If they are actively suicidal, it certainly does. But remember, the risk of dying from smoking-related diseases is quite high, so we need to treat it for a serious health problem that it is. Now, the next thing you can do to help besides medication is call them or have your nurse call them at day 2 or 3. The maximum amount of withdrawal from nicotine is usually day 2 or 3. So if you call them and encourage them, that can be helpful. Or have your nurse do it at day 2 or 3 and tell the patient ahead of time. That can be helpful. The other thing that can be helpful is motivational interviewing, which is not, come on, you can do it, but rather, what is your motivation to quit? What is your motivation to do this? What does smoking give you? What will quitting do for you, whether it's saving money or saving your health? And sometimes if you ask people, why are you doing this? They may say, I want to be alive for my daughter's wedding. Or I want to save money. Cigarettes are expensive. I want to save money, go on vacation. If you have them put a picture of that reason, their daughter, or a picture of where they want to go on vacation, next to the nicotine patch box or the bupropion or Chantix bottle, that can be helpful as well. So anyhow, that is treating nicotine addiction, which can be very difficult, in 5 minutes. Please read more. Thank you.